kind. All right, so we are now live. Commissioner, please begin when you feel like it.
Okay, good afternoon. Welcome to the Health Commission Finance and Planning Committee meeting for Tuesday, September 3rd. And Dr. Chow, will you read the land? Oh, I'm sorry.
Yes, I'll do the roll and then I'll read the land acknowledgement. Commissioner Chow, I will start with you in terms of calling the roll.
Present.
And Commissioner Guillermo.
Present.
And I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on. Commissioners, okay if I call the items?
Sure.
Item 2 is the approval of the August 6, 2024 Finance and Planning Committee minutes.
Okay, we have the minutes in front of us and have reviewed them. Is there a motion to approve?
I would so move.
And is there any public comment on the minutes in the room? I see none. So I will do a roll call vote because we have a commissioner participating remotely. Commissioner Chow, how do you vote on this item?
Yes.
Commissioner Guillermo.
Yes.
Thank you. We can move on to item 3, the monthly contracts report. Ms. Ruggles.
Afternoon, Michelle Ruggles, DPH Business Office, and a lot of contracts. I'll go through each of them, but I just wanted to put an overview together. So there's 9 contracts. There's 8 vendors. 8 of these contracts you've actually approved before. There's one that's new to you because it didn't meet the threshold for Health Commission approval. 6 of the contracts today are amendments to the existing contract, and then 3 are continuing existing services with the same vendor under an original agreement, typically following a solicitation. All vendors are subject to the fiscal and compliance monitoring, and all are in conformance with the standards, except 3 of them have a couple follow-up items. 2 of them have the same item, which is the public posting of the required 2 public meetings and or holding the meetings. And then one was late in submitting a financial report and one has to adjust the presentation. So in good shape, these vendors. So I'll begin with the first one, Asian Pacific Islander Wellness Center, doing business as San Francisco Community Health Center. This was originally funded with a grant, and the grant funding was 1 year. But when the contracts office set it up, they hedged, thinking it might get continued. And so they added an extra year. And as it turns out, additional funding did become available through the state opioid settlement funding, which is being added to continue these services for the 2nd year. This program funds the Tenderloin Night Navigator program, and the increase in funding, the annual funding, represents going from 4 days per week to 7 days per week for the hours of 7 p.m. to 3 a.m. So that is what that program is, which you've heard before. But if you have questions, we have a representative online.
Great, thank you. Are there any questions?
The only question I had was that since it has been going on, what has been our experience that, it's going to be great. There'll be 7 days, but what has been our experience with the number of days that they had been operating? Because I know it's too early for a formal evaluation at this point.
I will defer to, I believe, Emily Raganol, if she is online. Is that-
Yes, I'm here. Happy to answer that question, Commissioner Chow. The Night Navigator program has been incredibly successful in the 4 days that they've been operating, and now 7 nights a week they've been operating. What they've been doing most importantly is linking people to medications for opiate use disorder through a telehealth phone line. So they'll go out in the evenings with a phone and call a doctor to actually get them started on buprenorphine for the treatment of opiate use disorder. And in some cases, actually get them into a supportive housing site where they're able to stay for up to 7 days as they get stabilized on these medications. I don't have figures off the top of my head, but I'm happy to follow up with Mark and provide some of those figures of how many people they've served since they began these services. But anecdotally, my understanding is that most nights, if not all nights, every single possible slot with a provider has been taken, meaning that they've like filled up all the provider time that they have available to them at night.
Very good. I think we do have the annual numbers that were listed here, which are considering that it was only operating 3 days a week. I mean, it indicates 2,250 contacts.
Yeah.
That's tremendous, and so the expansion should be quite helpful, from what I understand. So I have no other questions. Thank you.
Thank you.
Thank you. I have a couple questions. One, so I think we've heard about this program anecdotally from Dr. Coonens or someone from the MHS.
I think Krista came and spoke about another contract and talked about it at the full
Yeah.
commission.
So it seems as if there is some assurance that we're going in the appropriate direction with this program. So that's very reassuring. I was wondering, so besides API Wellness Center, there are other contractors, right, that are working on this program, or is it just API Wellness?
So it's got a couple layers. API Wellness Center is the owner of the contract. And then they do this contract, the night navigators are under Code Tenderloin. And then Code Tenderloin has a fiscal sponsor, which is part of the contract. And so that's how it works.
Okay, so given those layers, each of the subcontractors then will be responsible for providing the information that will then be, I guess, aggregated up to a report for API Wellness?
Yes. And that's actually, we're looking at that too, to make sure that the units of service, especially because this is so aligned.
Yeah.
I'll call them by their right name, though what they're using. San Francisco Community Health Center has such an integral part that it makes sense to include all the units and not separate them. But I was provided this, and Emily, jump in if I'm wrong, but of the program staffing, for example, there's 8 night navigators. There's 1 night navigator manager, and those report to Code Tenderloin. There's a senior director of night navigators that's paid for by the Code Tenderloin. And then there's a case manager supervisor, also part of Code Tenderloin's programming. And, but they all, like, they're working all together and managing the piece. It looks like I cut off I copied and pasted the piece of what San Francisco Community Wellness Center, but they also have staffing that are coordinated with the night navigators and providing oversight. So that's the goal, and that's what I'm checking to make sure that we capture all of it, because it's such a major and successful initiative. We want to make sure that you can see everything that you want to see when you look in the contract, because it's all key.
Great, that's reassuring, because it is something that I think the public, as well as the members of the commission, are paying a lot of attention to in terms of the innovativeness and the opportunities that this might provide for us in really impacting the population and the need that's that it's addressing. The other question that I had was that given that this is opioid settlement funds, what happens after 2025? And if the program is successful, as we hope, is there another source of funding, or will the opioid funds be able to be continued?
We often find a way, but I'll defer to Emily. I'm not really sure about how the opioid settlement funds work and if there's more to say on that.
Yeah, so the opioid settlement funds are ongoing. We were only able to do this contract through fiscal year 2025 because we initially did a 2-year pilot project sole source, I believe, as our authority to fund this. And so we will be RFPing the services for fiscal year 26 and ongoing.
And would that be then another 2 years, or would that be?
It would
Or
be for
you-
at
you
least
haven't determined?
5.
Okay. All right. Okay. No more questions. Thanks. You can go on.
Okay. The next contract is Richmond Area Multi-Services. We call it for short RAMS. This is a contract that's under the DPH section, Whole Person Integrated Care. This is a contract that you've also approved before, but it was part of a larger behavioral health services contract, and now it's a standalone Whole Person Integrated Care. And what the peers do is RAMS provides peers that are integrated into the multidisciplinary teams that are operated by Whole Person Integrated Care under the umbrella of street teams. And so they're providing the peer portion, the connections that come with that role as part of this contract. So it's a new contract for continuing services, and we put it into a 5-year contract term.
Is that it?
That's it, sorry.
Any questions or comments?
I had no questions because we received pretty extensive reports regarding their monitoring. So thank you.
Yeah, I think we received quite a number of monitoring reports last month on RAMS, and there's some questions about their, sort of the size of their total
Yeah.
contracts, right? I think,
Oh, for RAMS?
yeah, program.
I've been working on that, and I will send that. We don't have all the 24, 25 budgets, but what's super convoluted is that we are following the path and recommendation of the city attorney to not mix our contracts anymore with different solicitations. So I think there's 8 that have moved out into new contracts. So I can send you that or have it for the next month, whatever your preference is for them, for Felton, because they're both convoluted in that same way. And it hasn't been a slam dunk, but it's probably 3/4 done.
And then I noticed on this report, as well as I think on Haluna Health, and you mentioned it, the public facing or the public meeting requirement.
So,
Yeah. So because they're a private nonprofit, I guess their board meetings aren't open. So is that going to be taken into account, or is that something completely different?
No, that's a finding.
Okay.
So that was a finding in the fiscal and monitoring. I didn't read the San Francisco Community Wellness piece as much as I focused on before. We had them last time.
You meant RAMS.
RAMS, sorry. RAMS is in conformance. So the 2 that were out of conformance on that public meetings was Haluna Health and
I thought it was RAMS. Sorry.
it's not RAMS. Okay, maybe I lost it. Oh, Catholic Charities. So it's Catholic Charities and Haluna Health did not do the public. Well, it's 2 things. So RAMS is good. They're in conformance with all the standards. Haluna Health, that one will be remediated. There was some clarification that needed to be made because the instructions to them hadn't been consistent, but they're not located here. So they thought that put them, that they didn't have to do it. And I guess in the past that had been accepted, but it's no longer. So they'll have to do it. So, I mean, it's a requirement that will be checked, and that's been clarified, that expectation. For Catholic Charities, I think I could be wrong, but I think what the Catholic Charities is that they didn't do the posting. What they did instead, they did have the meetings, just not the posting. And so that's a finding that will be checked in the next financial fiscal monitoring for next year.
Okay, great, thanks. Sorry to take you into the other contracts, but okay, okay. No other questions on the RAMs.
Testing my memory to see if I knew where we were.
Health Right.
Okay, so
Yeah.
Health Right 360. This is a new contract. It's an amendment to an existing contract. And the amendment is to add carry forward funding. There's an increase in funding to add the carry forwards, but there's no term change. This is a program administration that supports HIV health services for their grant funding. And the general fund that's commented on in there is because in recent years, there's been an add back for cost of doing business for this particular Ryan White grant funding, because typically the funding that we get for cost of doing business is applied to general funds and not to grant funds that come from the grantor, but it was. So that's what that general fund references in this contract. But anyway, it's a program administration contract. And previously, we had treated program administration contracts with the same vendor as ongoing. And so we didn't bring them if they already existed. But I think it was Commissioner Chow requested that we treat it as each project is we look at the project. So the Luna Health might have 20, but we should come 20 times if it's 20 different projects. So here's HR 360, and it's pretty straightforward, but that's what it is.
Thanks. Any questions or comments?
No.
None here either.
Okay. So then the next contract is Helena Health. And this is also a program administration contract for PhD, Public Health Division, and it's for their public health infrastructure grant, and it's helping the section to help them manage this grant. And so this contract was here last September 2023, and the increase in funding is due to carry forwards. That is increased grant funding. We just talked about this, the public meetings. They also have to change how they report their financial report to include annual cash flow reserves and not monthly, which is how they do it now. So that's what they'll be doing.
Yeah, I saw that in the summary. Yeah. Dr. Chow, any questions or comments?
I had no questions.
Okay. We can go on.
The next contract is Shanti Project. This is an amendment to extend the term by 2 years. The funding increase represents additional grant funding. They were in conformance with all of their financial standards, with the exception of the deadline. They missed the deadline to submit the audited financial statements, which are now turned in, but they were late. So that was the finding. And the reason for them being late was just all of the changes, that the conversion to Epic is what they told us. So that's.
Okay, thank you. Any questions or comments?
Is this the only Shanti contract in here?
Today we have, no, we actually have this contract today, this contract on the monthly contracts report, and then there's a new contract that's on a memo, a standalone Health Commission memo.
Okay, so I just
Oh.
had,
Sorry.
is this the one that's on the medical care management collaboration?
Yeah, I'm sorry, there's 3 contracts. There's 2 on the monthly contracts report. This one that I just brought up, which is integrated case management with HIV health services. And then the very last contract on this contracts report is the cancer navigation and survivorship program services. And then we have a new contract.
Right. So this is the one I forwarded a comment, but it's over the holiday. We're in the evaluation. There was under the client satisfaction rating that it was indicated that it was commendable because it was at about a 75% approval rating. But the way that I have read the results, and this is on the last page of the client of your fiscal report, and it was that each of the questions had about it looks like a 40 to 45% approval, and it looks like that getting the 75% was adding 43 and 31%, but I couldn't quite see how we added them all up when each of them were individual questions that, for the most part, were at about a 45% level. And
I apologize. I do not have it in front of me, and I think
Sure.
I need to go back and ask about that because I missed your question. So unless Beth Neary is online, happens to have looked at that. Otherwise, I can definitely check with the BOCC monitoring team and see how that is weighted because I don't know without looking.
yeah, because it looks like they did the survey. There were 2 surveys that were added together, and each of these, and so you can come back and give me the answer. But when they said I gained a better understanding of issues related to my health, each of the surveys, each of the 2 surveys had a 43% response.
Yeah.
And that I assume was yes. And then they added the 2 together and said they had a 75% approval. But I don't think you can add the 2 together like that.
Yeah.
That was my only question, was whether or not we're doing that correctly. Certainly in terms of the units of delivery and everything, that was not a question, but that just sort of stood out as a potential error in being able to add from 2
Yeah.
different surveys, right?
Yeah.
And there are questions like that.
Let me follow up and get back to you and see if there's some reason that wasn't explained or if it was an error.
Sure.
And I'll let you know.
No, that's fine. Thank you.
Okay.
Do you want that answered before the full commission, Dr. Chow?
No, I think that they need to correct that though. I mean, if it's an error, then the commendable is actually different in terms of how they score it and whether or not that creates some sort of feedback for the next year or whatever it may be. That's all I'm asking for, because this has to do with the client satisfaction.
Okay, so we don't have to hold that one back.
No, I wouldn't hold it back. I just asked that if we're misinterpreting this and their number of 75% was correct, then they reach a commendable level. But if in fact there was an error in looking at each of these 2 surveys and then adding together the numbers to create a higher number that reached commendable, then it only says, what does that trigger if it's really at about 45%?
Yeah, I'll find out.
Okay.
Yeah. So, you can just let us know what that is, but I don't think it should hold up the contract.
Okay, thank you.
We can move on.
Okay. The next contract is Felton Institute, and I'll just say, and then after the one after that is Harm Reduction Therapy Center. These are both contracts that were recently solicited. The Behavioral Health Services Transitional Age Youth Team section just resolicited all their services. So these two contracts on Felton that we're talking about now, they were resolicited, both are continuing the same services under new contracts. And so that is what is before you today. The Felton Institute contract, the request is 5 years. We'll take this to the Board of Supervisors for approval because it exceeds the $10 million. The increase, just to compare, so you have a reference point between the two fiscal years, is for the cost of doing business. And I think that's it.
Yeah, so I have no questions.
Okay, go ahead. Go ahead, Dr. Chow.
No questions
No
on the
questions.
Felton.
Oh, okay. Yeah, I have no questions. on
Okay.
that.
So then the next question, same thing that I just explained for Felton, is Harm Reduction Therapy Center. The services went out to bid. This is a Transitional Age Youth Behavioral Health Services section. They are, they received the same services. So this is a new contract. You heard this actually back in July 5th of 2022. And let me know if you have questions.
The question I had, which is really more global and not related to the contract specifically, is in some way we should sort of try to be able to understand also not just the large number of contracts that particular agencies have, but how many programs are really going into particular types of services, such as the TAE services, because this is not, of course, the only intervention with this population. So I don't know exactly how that gets looked at, but it would be, I think, an important outcome issue that one might take, all the TAE programs and let us know, how they're all functioning and how they interrelate to each other, and therefore, what is the program that he's doing for this particular population. So, I know this is part of it, and my questions aren't related to this contract, but the overall question of looking at some of these by the populations being served.
Yeah, that's a great point. And I think it's fallen off a little. And as soon as we can get more organized, what we did before, just to try to help and give you context, because these contracts don't normally come together, is following a solicitation. Back in the day, I still reference the old solicitation. The program would come and do a presentation about that service area, what it is, who it's serving, how you get into services, how you get out of services, the rates, that kind of like global information. And that's certainly something that there's been a lot of solicitations, whether it's in this meeting, I don't know if it goes to a different committee, but we can definitely start doing that again. It's just a matter of getting everyone organized to do it.
The way that Jessica Brown presented the recent Black African American maternal health, is that because she came and presented a presentation of everyone that was funded, and then when the contracts came out, she would remind the commissioners of that. Is that the kind of thing you're talking about? Okay.
Like the big ones. This would have been a perfect one because it was all the TAE services just about in one solicitation.
Right. I think that, I think commissioners, you all appreciate that because there's a context to each of the individual contracts that come out over the next months. At least you can refer back to it. Is that something that you'd be interested in?
Yeah, I think Commissioner Chung has also mentioned that a few times, so.
One of the ECMS, our electronic contract management system, just went out to bid and they've selected the vendor. So it's at the early stages, but that is the goal. All the programs, all the sections, and then we could sort easily and it wouldn't become a whole research project. Here's the programs, here's the vendor, here's what they're doing. So there'd be a lot more ability and capacity to give you overviews that were helpful.
Right, more contextual. And when should we expect that to come to us or on a regular basis?
Well, we can start to do that without the ECMS, the electronic contract management system. What happens when we do a solicitation, there's a solicitation summary and it tells you who was selected and a little bit about what the service is. So that can be the marker. It will be much easier when we have consort and it's in a system. But before that, we can start doing that again. There's been a ton of solicitations, so we should maybe line them up and maybe want to look at which ones would be like a starting place. Sometimes the
yeah.
solicitations, there's always this sort of, the city attorney, we would if you have more, for every solicitation, you need a separate contract.
Right.
And so sometimes we want to have a bigger solicitation so we have fewer contracts. So all that means is sometimes like outpatient might be in a few different contracts that we need to pull together. But we can definitely start doing that.
And commissioners, I'll work with Michelle to get a
Just that,
list of
yeah.
this.
Yeah.
Yeah, I'll figure out a rhythm and I can check back with you all and Commissioner Chung on that. So in the next, between now and the next meeting, I'll check in with you and then we'll go from there.
Right, because you have the best sense of what we've been trying to get at.
Sure. And I'll check with
that context.
Commissioner Chung and then you and Commissioner Green at the other level to make sure that we're taking care of both the full commission's needs and the committee's needs.
Great, thanks,
I'll
Mark.
share some of the historical ones that we've done.
Great.
So, and also for behavioral health services, they've been building that capacity when we go to the Board of Supervisors, so they take a contract. It's always a project, but it also means it's not starting from scratch. So I think some of that context can be fairly easily available.
Great. Look forward to that.
Okay, Catholic Charities. This is an amendment to extend this contract by 5 years. It's already currently a 5-year contract that you approved previously. This provides for HIV facility-based care services through attended care certified nursing assistants. The contract, I mean, it's pretty straightforward. The increase in funding, let's see, I forgot to write it down. What cost doing? Oh, it's changing in the grant funding and the adjustment is incorporated into the 5 years, but also showing you the 2-year change. And this Catholic Charities needs to become in conformance with the posting of their public meetings.
Is that it, Ms. Ruggles?
I'm done, sorry.
Any questions, commissioners?
Dr. Chow, do you have a question?
No questions.
I had one quick one on the funding source for the general fund. Is that the same reason for adding or using general fund as with, is it Shanti?
Is that,
Or no,
yeah,
was it?
are you on there? I hear my name.
I believe Ms. Neary is right behind you.
And I know the answer now to the earlier question. Yeah. No, so this one actually is a much larger segment
Oh.
of general.
Ms., could you say your name and your title just so for the record?
Yeah, Beth Neary, Assistant Director of HIV Health Services. This one actually is a much larger, it's about 660,000 in local general fund. And it started a long time ago under Housing and Urban Health in the department, but when the Department of Supportive Housing and Homelessness separated it out, the funds moved here because it was all for people living with HIV. But it's the medical case management component where the housing is paid for by different people.
That's where I'm sorry.
Sorry. The general fund is now regular HIV Health Services general funds. And it
Okay.
once was managed in the department 8 to 10 years ago by Housing and Urban Health and has been consolidated with all the other HIV directed services and funding
Okay. When was that?
about 8 to 10 years ago.
Okay.
Yeah.
Thank you.
And may I share an answer to Dr. Chow's earlier question on the Shanti?
Could you reframe the question just so we're all on the same page?
Yes, so one of the BOCC monitoring reports had, it noted some very good positive client feedback in the neighborhood of 75% positive. And they fielded the survey among 3 different audiences. But when they aggregated it, it's not the different surveys that they were aggregating. It was strongly agree and agree that they were aggregating. So it was about 43% strongly agreed and 32% also agreed with the positive statement. So they were saying 75% of people agreed positively overall to that particular statement. Does that make sense, Commissioner Chow, to the original question?
Well, yeah, I guess that makes sense. The way it was written is sort of odd, but you're saying that each of these numbers are very strongly and strongly, or that both were positive numbers. Okay.
Yeah, so they left out the neutral and disagree and strongly disagree.
Sure. No, okay, that's fine. The way it was written, it sounded like that. We just picked up each of the surveys separately and then added them together. But if we're actually then adding by points from each of the surveys, then of course that would make sense. Okay.
Thank you for the quick answer.
Very much.
Okay. I think the last one is Shanti again.
So this is Shanti Project for the departments and working with Shanti Project Cancer Navigation and Survivorship Program Services. This is an amendment to extend the contract for 1 more year, which will allow for the completion and development of a new contract following a solicitation. The increase is due to, it's summarized, due to increases and decreases in the funding between fiscal years.
Right.
And then we already talked about their fiscal monitoring.
Any questions or comments, commissioners?
So I have no questions.
None here.
So commissioners, please consider a motion to vote to recommend that the full commission approve these contracts and the contract report.
I would so move.
Okay. 1 second.
And Commissioner Chow, how do you vote on this item?
Yes.
And Commissioner Guillermo?
Yes.
Thank you so much, Ms. Ruggles, and everybody who supported you today. Let's move on to item 4, request for approval of a new professional services contract with Asian and Pacific Islander Wellness Center, the San Francisco Community Health Center. Yes, and just speak normally, and please introduce yourself so everyone knows who you are.
Fantastic. Hello, Commissioners. Good afternoon. My name is Jenna Rapwest. I use she, her pronouns. Current role is Program Director at Gender Health SF. I was one of 3 folks who spearheaded the RFP under Behavioral Services for the expansion of behavioral services targeting transgender, unhoused transgender, non-binary individuals in San Francisco under Behavioral Services. So the contract was awarded to San Francisco Community Health Center, and I'm here with the CBO partner who can provide any more details around the contract. There are 3 service areas that are targeting the contract. One of them is expansion of behavioral services for unhoused trans individuals. Another one, program number 2, is providing service navigation linkages for unhoused transgender individuals And then number 3 is capacity building, particularly around building capacity and providing services, providing technical assistance within our systems of care to build capacity to serve unhoused transgender non-binary individuals.
Commissioners, would you, do you have questions, or would you like CEO, Mr. Toma, to come and speak, or would you like just to ask questions and go from there?
Well, I had an overall question because the center has been growing apparently quite rapidly as to the capacity. Are we over, extending ourselves in asking the Wellness Center, even though their willingness to do it, in order to be sure that they actually have the capacity to continue to carry it out? Or are we going to cause a problem with them as they struggle? So I'm not sure if it might be useful to understand the growth and the many contracts that they have been picking up over the last several years from us, and they're feeling that they have that capacity.
Commissioner, if I may dig a little deeper to make sure that the question is understandable on our end, are you concerned about infrastructure and the admin infrastructure and/or the actual hiring of people in the program? Could you elaborate a little bit so that the folks who need to answer could understand where you're coming from a bit more?
Well, it is the infrastructure, the administrative, ability to do this, and that goes along with managing the people then that have to be there, and the feeling that they do or don't have that capacity, because quite often, agencies might like to continue to do something, and we might just tip them over in terms of adding to their burden, and they would outstrip their own capacity to be able to manage adequately the contracts. So knowing that they started very small a number of years ago, and watching them actually take on more and more projects as they became a community center, I just wondered if we could understand how well they feel that they can actually handle more contracts.
Thank you for clarifying.
Fantastic. I can comment on the programmatic side of things, and then I can ask Executive Director Lance Toma to come up and maybe talk about the administrative side. Just a comment on the programmatic side of things. I've been with the department for 20 years, and I've done transgender specific work in public health. And so much of what we learned over the past 20 years and 2 decades is really building services and programs that are complementary and integrated to ensure that trans folks are able to receive the services that are going to be needed kind of where they're met in terms of what's going for them, particularly for this population, unhoused, transgender, non-binary individuals. So much of it is, so much of the funding sources from Our Community, Our Home, HSH, to really expand services to target this unique population. So much of our public health programs have been addressing other social determinants of health, but really this is focused on unhoused, transgender, non-binary individuals. With that, I'll turn it over to Lance Toma to maybe to comment on or talk about the administrative side of things.
Mr. Toma.
Thank you, Jenna. Hi, Commissioner Guillermo and Commissioner Chow. I'm Lance Toma, CEO of San Francisco Community Health Center. I very much appreciate your comment and question, Dr. Chow. We have been growing, and I think and I have been the CEO of San Francisco Community Health Center since 2006. And what our goal at our health center is to really ensure that we're meeting the needs of our communities. And that's inclusive of the Tenderloin community, the homeless community, substance use, the fentanyl overdose crisis, the mental illness crisis that we face, and really supporting the goals to end homelessness amongst transgender and gender diverse individuals. So we're actually really excited to provide the services that are outlined in this specific contract because the need is so profound. And what I can share is that our growth is is of note. We have been growing, but part of my role as the CEO and executive director is to ensure that we also build the infrastructure capacity to manage both the contracts and our third-party patient revenue for our health center. And I think over our 34-year history is really much about grants and contracts. We have been a partner with the San Francisco Department of Public Health since our beginnings in '87. And so I really do feel like our grants and contracts infrastructure is quite robust and solid. And so this particular contract complements so well what we have built over time at our TransThrive Center, which is now housed on Pine Street, and our most recent venture, which is overseeing the operations of the Transgender Navigation Center, Taman Bhutan Navigation Center, which is south of Market on Bryant Street. So what we see is, of course, that the behavioral health needs of our communities at TransThrive and at the emergency shelter are so critical. So by enabling more support around both peer support, navigation, behavioral health support, and then building capacity for our city broadly is going to really help serve the residents of the shelter and the clients we're serving at TransThrive. So it complements everything that we're doing and is responding directly to what we see as an on-the-ground need.
Well, very good. And I really do appreciate your comments. Clearly, your leadership has raised not just the awareness, but the capacity of the Wellness Center. I remember when it first started and came together and was working, obviously, pretty exclusively with the HIV
Yes.
epidemic and the Asian community. And just to watch you grow it to meet the needs of the remainder of the community clearly demonstrates your commitment and your skill and your own administrative capacity. So thank you for coming before us and reassuring us that the growth is really within and this contract will be within your capacity and actually complements the work you're doing. So thank you.
Thank you so much, Commissioner Chow.
I'd also like to just add, being familiar with the community centers from its very beginnings as the GAPA Community HIV Project, very long time ago, that the vision and the mission that was stated even back then has remained constant. And the populations that you care about and have actually impacted, I think, are very significant. So I'm hoping that both operationally, administratively, this is something that you will be able to maintain sort of the high quality and performance that you've been able to address across all the different programs and projects throughout the multi-decade history.
Thank you so much, Commissioner Guillermo. We will make good on our promise to deliver for the community.
And then commissioners also, I want to also give credit to the business office for managing the financial side and checking on these things through the monitoring. So thank you for your response. And I know also the DPH will be doing its due diligence to help support you in making sure that what you're doing makes sense in terms of this contract.
Great. Okay.
So commissioners, if there's no other questions, please consider a motion to add this to the consent calendar for the full commission to approve.
I would so move.
And I would second.
Commissioner Chow, how do you vote on this item?
Yes. Yes.
And Commissioner Guillermo?
Yes.
Thank you both, and thank you for speaking today. Item 5 is a request for approval of a new professional services agreement with Pacific Neurophysiological Systems, LLC. Betty Kukin, come on down. And I don't know if you heard me earlier, just speak normally. That black bar is the microphone.
Good afternoon. I'm Patty Coggin. I'm the nursing director for surgical and procedural services at San Francisco General Hospital. what questions?
Can you give like a elevator speech of like what the contract will do and the motivation behind it?
Sure. We contract out with vendors for neuromonitoring services. We have a vendor that comes out. We do about 200 cases a year that require neuromonitoring services. The vendor comes out, they apply electrodes to the patient intraoperatively, and they monitor the patient for changes in their nerve status by looking at a waveform on a monitor for the duration of the case. And if there's any changes or anything that would indicate that there had been some form of nerve damage to the patient, they would notify the surgeon, and they would stop the procedure and decide what to do next.
Thank you.
Any questions?
No questions.
I did have one. So this, who provided the service prior to this proposed vendor?
So we've contracted with Golden Gate Neuromonitoring. So we went out for the RFP process last year, and there were 3 vendors that made it through RFP. And Pacific Neurophysiological Services was one of those vendors that made it through the RFP process. It's great to have more than one vendor. We do have circumstances in which our vendor, if it's Golden Gate, would not be available, and we would need to have another vendor available.
So this is a sort of a backup of vendor?
Yeah, it would depend on availability. So we would determine, it's very short term. We find out either a few days before, a few hours before that the procedure is going to go. So they would see if the Golden Gate was available. If they weren't, they would reach out to the second vendor.
I see. Okay. So we still have a contract with Golden.
Yes.
Okay.
And
Thank
I'm
you.
sorry, could you repeat the name of Golden Gate? I missed the second part of the name of the,
Golden Gate Neuromonitoring.
thank you very much. And so any other questions or comments?
None here.
All right, so thank you. Please consider a motion to add this to the consent calendar for the full commission to approve.
So moved.
Second.
Commissioner Guillermo, how do you vote on this?
Yes.
And Commissioner Chow?
Yes.
Great, thank you so much. That's the end of our contract discussions today. We can move on to item 6, updates on SFCO program funds and launch of SFMRA funds, finder tool, and public awareness marketing campaign. Give me a moment to pull up the presentation. And please just say next slide or whatever you need. Please, please introduce yourself and begin.
Good afternoon, Health Commissioners. My name is Stella Chow. I am the Director of Managed Care of the department. I am here today with 2 of my colleagues from San Francisco Health Plan, GB and Ioana. We are going to introduce you to the 2 programs we are launching later in September. One is a fund finder tool. Another one is a public awareness campaign. We have not done such campaign for the SFCT option program before, so we would like to bring that to your awareness as well. Next slide, please. Here is the agenda. I will give a program overview to level set this group before Ioana and JB to go into details about the 2 programs we are launching. And then I will also share with you our communication plan before Q&A session. Next slide, please. Level setting. What you are seeing here is a journey map, basically highlighting the key events of the San Francisco City program from its inception in 2006. And the program was created under the Healthcare Security Ordinance. So if you see a lot of acronyms, please look at the bottom of the slide. Healthcare Security Ordinance, SFCO is city programs, ACA, Affordable Care Act, HAO is the Healthy Airport Ordinance, ESR stands for Employer Spending Requirement. That is part of the Healthcare Security Ordinance. So going back to the journey map, 2 years after the board approved the healthcare security ordinance, the San Francisco City Option Program was launched. And San Francisco SF Medical Reimbursement Account, which stands for San Francisco Medical Reimbursement Account, it's a program underneath the SFCO. And San Francisco Health Plan was contracted to be our third-party administrator. That's why they're here today. Fast forward, in December 2021, January 2022, the program has been approved for in-shipment policy. And that policy was, the goal of that policy is to address the inactive fund of 3 years according to the state law. Since then, we've been working together with the health plans, with the tax and TTX. I forgot what it stands for. Treasurer and Tax Collector's Office. I'm sorry, so many acronyms. And the Controller's Office to help prepare for this in-shipment events in 2026. Our goal is to reduce the amount to be in-shipted. Therefore, we have launched 3 rounds of in-shipment since January 2023. And the last round ended in, I believe, April this year, a few months ago. So as part of that in-shipment outreach, we are launching 2 programs. One actually is the SFMRA Funds Finder tool. And then the other one, also later in September, is the public awareness campaign. We will talk more about that in the next slides. Next slide, please. This slide is the SFCO by the numbers. Since its inception in 2006, 1.9 billion employer spending contribution have been made by over 5,000 employers for nearly 500,000 employees. You may wonder why the 1.9 do not match with the $1.7 billion in the table, because there are roughly 1.5 to $2 million was contributed and moved to support the Healthy San Francisco program and the SF Cover MRA. Because that 2 program has been sunset, that's why we, in the table below, we just broke down the current program, which is the SF MRA. So as you can see, 80%, 20% of the fund is still in the pool waiting to be for the employees to claim, and 80% of the fund either in the claims as payout in claims or funds in active SFMRA accounts. And a small portion of that was paid to the account fee. Keep going, please. The in-shipment is 3 years from the implementation day, so it will be now 2 years from today, roughly, in 2026. Next slide, please. Keep going. Okay. As I mentioned, 3 rounds of enhanced program outreach have taken place between early 2023 and March 2024. And we are also planning additional campaign to make sure that people are aware of the funds they have in their accounts. And also utilize the online tool to look up the funds that are available. So the bottom, the numbers, the bars here, I'm actually showing the dollar claims and paid. And can we keep going? Showing all the arrows. So the 3 yellow arrows, 1, 2, 3, is where the the instrument outreach took place. As you can see, consistently, 2 months after the outreach, the money moved a lot, the highest in that period of time. So our most recent outreach was concluded in March, so we are still waiting for the report to come in, but it has been very successful in the last 2 rounds. Keep going. So I will talk a little bit more about the 2 projects that will be launched in September. An online fund lookup tool, essentially. We call that Funds Finder tool. And someone, let's say if they see the public awareness campaign all through other channels to see that, oh, actually I can see if I have fund available, and someone can actually self-serve using the Fund Finder tool and go into our portal to find out if they have the funds. If they do, then they will be automatically routed to a enrollment form that is currently being manually processed. So that would help us to streamline the enrollment into the SFMRA programs. Next slide, please. Oh, I already covered all of this. Let's keep going. Yeah, so our goals, of course, streamlines our workflow internally, but also, and also improve the customer experience. And how does it work? Now I'm going to pass the baton to Juana to talk a little bit more about the online tool.
Good afternoon. Good afternoon, commissioners. Thank you for the opportunity. My name is Ioana Stekles. It's my first time here, so I'm very excited. If you go to the next slide, please. You can see here the landing page of the website, and thank you so much, Stella, for mentioning this. This is the first time anybody from the public can go to the website and actually search to see if they have employer contributions into San Francisco City Option, which has been something that the community has asked for a long time. I think it's been discussed in this meeting also, so we're very excited about this. The landing page, as you can see, at the upper left, we have the logo for the SFMRA program, which is the benefit for San Francisco City Option. It includes now, for the first time, the city and county of San Francisco seal, and that's going to bring trust and credibility to the website. The other thing too that you're going to see on the upper right page is the users and the visitors to the website can navigate between the different languages. We have the website available in the 4 threshold languages for the San Francisco City program, and that is English, Spanish, Chinese, and Tagalog. In order for the form to work, the visitor or the user of the website has to provide 4 pieces of information. And this is the standard that we ask for any person that is asking, information about the program. So you have to provide your first name, your last name, your date of birth, and the last 4 digits of the Social Security number. So after they provide this information, they also have to successfully pass the reCAPTCHA. And you might be very knowledgeable about that as we all use the internet, I think, quite a lot these days. That's a free tool that is provided by Google, and our San Francisco Health Plan ITS Security made sure that that's part of our form because it prevents spam and fraud and malicious software, right? And it differentiates between human users and computer users, machine learning type of things. So we wanted to make sure the form is safe and the information is protected. So once the user inputs all that information and they click enter or submit, if you can go forward just a couple of times, I think that information, there you go, perfect. There are possible outcomes. There are 5 actually. So if you click one more time, thank you so much. The first outcome is the first name, last name, date of birth, the last 4 digits of SSN, they match perfectly with what's in our database, which is behind the tool. And the person is never enrolled. So what we do is we say, hey, you have this amount of money, you have to use it by a certain date, and you have to enroll because we identify in the back end that the person is never enrolled in the program. So it's similar to what Stella mentioned. We connect that individual to the enrollment form in the San Francisco City Option, which is available on the City Option website. The second outcome is all the information matches 100%, but the person is already enrolled. So in that situation, we're telling them, this is how much money you have as of a certain date, And also you have to use it by a certain date. And we're directing them to their MRA account at our health equity vendor that manages the claims. And then and if they have access to the account, they can see the most up-to-date balance, and they can also submit claims for eligible expenses. The third option is the user matches partially the information. So we define that as a partial match. That means probably the individual had a typo in their name, first name, last name. I certainly have two, first name, last name, middle name too. So in certain situation, I use different ones. Or they have a typo in the, date of birth or the last 4 digits of SSN. So in that situation, the result of the page is going to direct the individual to submit an enrollment form because we need that information, and we're going to call the participant to make sure, we identify if they have an account or not. The fourth outcome of this is the information provided doesn't match with what we have in the system. So in that situation, we're telling the participant, unfortunately, there's no funds right on your name. That means that probably the employer never paid on their behalf. And we're directing them to an FAQ, a frequently asked question information on our website if they want to learn additional information about the program. And then the fifth but not least, is the user's funds have already been initiated, right? And we're only going to start closing accounts, as Stella mentioned, in 2026. So you're not going to see that option right now because we're not closing accounts yet. Any questions about kind of the overview? Finish? Okay, perfect. Wonderful. Yes. I have here in the next slide, thank you so much. This is an example of how it's going to look as a result of the page. So once the visitor or the user enters the information into the form, they receive information such as, hey, this is the amount of money that you have in the account as of a certain date, and this is the time and date when you have to use the funds by, right? And also in this situation, this example that we provided here in the screenshot is the participant is not enrolled in the program. They have funds, so we're directing them to enroll by submitting the enrollment form. And I think that this is where I need to transition it to my colleague, Gunilla.
Hey, Gunilla Bergenstein. I'm the Director of Marketing Communications. I'm also here for the first time. Thank you for having us. So this is a fantastic opportunity. So we have talked about how successful the outreach had been up to now, meaning that we have sent letters home to people because we have their address. But we also know there is a lot of funds that are not being tapped into. And we think that is because we need to spread awareness about this campaign. So next slide, please. We are looking at a multi-channel. Please click another time. We should take those things away for next time, don't you think? Yeah. So we are looking at a multi-channel campaign now. Right now, we are on social media and such, but we want to go big. We do send letters, but we need to go bigger. So here we are thinking of a campaign that we would go in print and in digital channels, meaning that we will go in the BART system so we can target people that commutes in and out of San Francisco. And we're going to use digital to target people, and it sounds terrible to say target, but to tell people that are making certain amounts of money, less than the 10% of the top. And if they live in San Francisco and 10 miles outside, that they might have funds. And the campaign, as you can see in the memo, is called Have You Worked in San Francisco? Next slide, please. What we hope what we hope to accomplish is that people know that there is funds available. I might be one of them to create a bigger awareness about this program. Here are some numbers. If we would go full blown out, this would cost us about $300,000. We're not going to do that. I'm just saying that is a full blown out campaign. This has already been funded. That being said, we have decided to start smaller because we want to track what is effective. So what we're going to do is that we're going to start with some digital formats in the BART and MUNI systems, meaning that we're going to be on platforms. We're going to be down in trains, and we're also going to be so we're going to be throughout the BART system, in the trains and in the platforms within the central city. And then we're going to be on social media. So we're going to be out for 8 weeks and it will cost us about $100,000. That said, we're going to be able to track each item out there so we can learn after 8 weeks what has been successful. I think, yeah, and I think it's good to know the money's there, but we want to be wise when we use it. We want to test because this is the first time. And now I think we're open for questions. No, Stella, that's you.
Okay, thank you. Um, Thank you, GB, Yvonne, terrible with names, for your presentation. Next slide, please. We're going to talk a little bit about our communication plan. As I mentioned earlier, the Fund Finder Tour has been launched since August internally to prepare for the promotional activity later in September. And we have started our communication plans since May 2020, this year actually, since May. And yeah, and then the Fund Finder Tour will be launched in September together with the public awareness campaign. And we have a long list of stakeholders that we are working with inside and outside stakeholders to make sure they are in the loop. And if you are interested in who will be informed, let us know. I think with that, what else? Yeah, next, I think with that, we can open up for questions.
Okay, thank you very much. That was very helpful and informative. Let me see if there are any questions from Commissioner Chow.
Oh,
Oh, Mike.
Commissioner, you're muted. Let me see if I can unmute you.
Oh, thank
Oh,
I guess I was curious initially about the first slide that showed that $1.9 billion. Is that the entire program over these years have collected 1.9 billion? Because the numbers you're showing, okay, all right, because the
It's
number,
since 2006.
it's since 2006, okay.
Yeah, it's
And-
just the total. It does not include the money already went out the door, yeah? Just the money in. It does not tell us the money.
Right, right. It doesn't show any expenditures. Then on that same slide, you then showed that there were over a period of time, I forget whether it was slide 3 or 4, if you can go back to that. I was trying to understand which were dollars that went out in a given year versus which were still left. It was just trying to see if, yes. So on, can you clarify the darker bar is what actually went out and the lighter bar is what is still residual?
Oh,
Is it-
this one.
Yeah.
Dollar claims, we cannot see the colors here. Now I see what the problem is. Dollar claims is the entire bar. Dollar payout is the shorter bar, the dark blue.
Yeah.
The darker blue bar. Because dollar claims, but if the claims is not an eligible healthcare expense, we will deny that, right? So that's why we have more dollar claims than dollar payout.
Oh, okay.
If that
So
makes sense.
this doesn't tell us how much was the residual in that particular period then, in
If
that
we can-
particular month.
Sorry. I'm sorry, I interrupted you.
Okay, so this is what was submitted as claims, like the last one, you have 21 million, and we paid out 16.7 million, right?
Mm-hmm.
Okay, so I guess your initial summary was how much money is still left that was not actually claimed, or?
Got it. If we might go back to slide number 2. And slide number 2. I'm sorry. It's 4.
Yeah, that one.
Yeah. 20% of the fund in contributed to for the SFMIA are still in the pool.
Oh, okay, they,
Yeah.
so
Wait.
it's 20%, 346 million, is that it? Yeah.
Yeah. Because the 1.9 include the money contributed to the two sunset programs. So after that, nearly $2 million, and it's $1.7 million in the SFMRA. And did I answer your question, Dr. Chow?
Okay, so going back up now to that top 1.9 billion, right?
Okay.
That's the entire program.
Yes,
And
since 2006.
right. And so what you're showing here is in the month of June, you had collected a total of 1.7 million, and there was still 346 million in the total pool.
I think this is cumulative, right? We took a snapshot in December 2023, and then we compare to the snapshot in June 2024. Because the
okay.
$1,731 million is $1.7 billion, basically.
So it's 1,731,000 that was your total, and there's still 346,000. Oh no, yeah, 346 million that's not being collected. I mean, that's not being used. That's what we're trying to get them doing?
Yes, this is where GB comes in to test out our campaigns, and we wanted to launch the Fund Finder tool, and we are hoping, we're trying really hard to help the employers to enroll in the SFMIA program and use that fund.
Sure, yeah, right. I mean, that's a lot of money, right? So I agree. And in terms of what you're spending then to try to go out to outreach, it's actually a very small amount of that, right? Yeah. Okay. Well, I really appreciate the effort that's going out again, and we'll, thank you for telling us that there is this renewed effort and tool that you have, which probably is going to be user friendly, right? Because they don't have to wait; they can go in and take a look at any time to get into their system. So, very good. Those are my questions.
Thank you. I did have one question on that same slide. There's a bullet that says, first escheatment expected in 2026.
Yes.
The first, haven't we had?
No, actually, we started to implement the policy in, I believe it's in January or March 2023. According to the state law, the money needs to be inactive for 3 years. So instead of looking back, we actually give people start everybody from zero, give everybody another 3 years runway. So if some of this money, let's say they're sitting there for 5 years already, and plus the 3 years, I mean, that's a lot of time for them to claim. We are really crossing our finger for the public awareness campaign.
Great. So I had a couple questions then about the tool and the communications plan. So it says the tool has been launched since August. And so is there any data on how well that tool is, or is that just the internal?
Is that okay, Stan? It was for internal purposes to make sure that we were doing a lot of testing to make sure that nobody can breach it, to the reCAPTCHA works. So yes, we do have some data in terms of utilization, and people are checking it out without any public awareness campaign. And it's going really well. So far, so good.
And prior to that, how people then access the information was just analog. There was no website, or there was no?
We do have a San Francisco City Option website, cityoption.org, where information is available for employees and employers. There are specific web pages with information. And then we also have an enrollment form that people receive the link to once they get the first contribution from an employer. We have a robust communication plan with the people getting contributions. I think the hardest part is getting to the people that maybe their employer never notified them about the contribution because they worked for 90 days for the employer, but then they switched jobs. So there are some people that we think, like Ganila, my colleague, said that some people that didn't know about the program for whatever reason. So we're trying to reach those people.
And that's what this new website is targeting. So for those who have been enrolled prior to this, would they use the old way, or would you try to get them to?
I mean, it doesn't matter.
It doesn't matter for them.
Answer. Yeah.
And
everybody
they
can-
know, if you are enrolled, they know they have money.
Mhm.
We are telling them, oh, now you use this much, now you have this left. We are telling them, like every month, we're sending them statement of how much. If they're users already, they're very well aware of how much they have. If they're not a user, those are the ones we want to reach now, because we're going to move the 346 million.
Right, okay.
Uh,
Go ahead, Dr. Chow.
Well, oh, no, I think it's, so it sounds like if you're a user, you get a monthly statement. So
Yes.
what we're dealing with is a whole bunch of people who aren't even using it.
Yes.
Again, that looks like the outreach is really very useful and very person friendly
Yeah.
for us to do that rather than just sending the money off to the state.
Yeah.
Thank- Yeah.
And can I just say that this tool is like fantastic opportunity. And you said it, Commissioner, about the newsworthiness of it. The fact that, have you worked in San Francisco? You might have money. I mean, who doesn't want to check that?
Can I make a clarification?
Yes.
You can-
Clarify. Dr. Chow, the money, when initiated, is going into the general fund. It's not going to be going to the state. But
Okay.
the process is following the state law, and we were working with the city attorney's office closely as well for the rollout.
Oh, okay, well, that's better, that at least if the money were going to be taken, it is going to stay in the city rather than going to the state. Okay.
But we want people to use the money, right? Our goal.
Oh, yes.
Yeah, with all this outreach, website and fund finder tool, and we will just continue on and to help people maximize their utilization of the funds.
I had a question about the digital communications. Because I would imagine that a number of the employees that represent that remaining 346 million are probably people that either no longer live in San Francisco, might not be reached by the print. So on the digital outreach, whatever tools you're going to use, that's going to be able to catch
Yes.
people. Is there a part of the plan that is specifically targeting people who don't live in San Francisco anymore?
Not at the beginning. We want to first test. We are targeting people within San Francisco and 10 miles outside. And we're going to see what are the most effective ways. So we start there, and then we're going to go broader. You can't, like, it's hard. You can target people on income, and you can target people on where they live. It is hard to target people on more specific than that. Well, we start here and see what we get from that. But we're also thinking there are family around, people that friends and family living in the city might see this, might know that someone has moved away. So we're hoping that could also make an impact. That's why we're going very hard on the places where people are commuting, but also, of course, on the digital media side, but not in the first phase.
Okay, well, this is all very impressive, and really the tool does appear as if it's something that is pretty intuitive and familiar with regard to what people would see on a lot of other sort of enrollment or search type websites. So I'm hoping that when you're able to test it, the data will prove that. So uh, um, wishing you good luck
Thank
in
you so
using up
much.
the money that is, that, should be used by folks, especially given that this is money that's meant for health and healthcare as opposed to just sort of a, random expenses or such. So hoping that folks are going to be able to use that for the kinds of things that they might need that isn't otherwise covered by insurance. So great. I hope we get to hear back on how things are going with the website and with the campaign.
Yes, we will do.
I work with Ms. Chow to schedule an update next year sometime, and we'll figure out what that cadence looks like.
Yeah. To wrap up, we want to thank the commissioner's guidance and continued support for this program. So thank you. And if you have more questions, please send those our way through Mark. Thank you.
Great. Thank you.
Thank you. And thank you for being kind to me earlier when I was frantic, when there was just 3 of us in the meeting. So we can move on, commissioners, to item 7, emerging issues.
Any emerging issues?
Hearing none, public comment. There's no public comment in the room, and there's no one who's been given permission to give remote public comment. So commissioners, please consider a motion to adjourn.
So moved.
Second?
Commissioner Chow, how do you vote on that item?
Yes, yes.
And Commissioner Guillermo?
Yes.
Thank you so much. Give me 30 seconds to shut us down. Thank you again.
Okay, thank you.
See you soon, Commissioner Chow.
Okay.